Do you know that there is an organ in your body that can be up to 90% damaged without giving you any pain, discomfort, or warning signal? That organ is your kidney. But what if I told you that without visiting a lab, without spending even a single rupee, you can check in just 6 minutes whether your kidneys might be in danger or still safe? Friends, kidney damage often happens silently. That is why it is often called a silent killer. Because by the time symptoms like back pain, vomiting, or severe weakness appear, more than 70% of the kidney may already be destroyed. And at that stage, the only options left are often dialysis or a kidney transplant. But don't worry. In today's video, I will show you 6 scientific home tests. These are simple signals that even nephrologists, kidney specialists, use for early screening. If you pass these tests, there is a good chance your kidneys are healthy. But if you fail even one test, it could be an early warning sign that your kidneys need attention. So let's begin your 6-minute kidney health check. Before we start the tests, there is something very important you should understand. Kidneys usually do not cause pain unless there is a stone or infection. Kidneys have a very powerful reserve capacity. Each kidney contains millions of tiny filtering units called nephrons. Even if half of them stop working, the remaining ones can work double time to maintain balance. In medical language, this is called compensatory hyperfiltration. That means the body often keeps functioning normally until only 15 to 20% of kidney function remains. That is why these home tests can be life-saving. Test 1. The pitting test. To perform this test, press your thumb firmly on the area above your ankle bone or on the top of your foot for about 10 seconds. After removing your thumb, check the skin. If a dent remains for a few seconds and the skin does not return immediately to normal, this is called pitting edema. When the kidneys cannot properly filter sodium and water, fluid begins to accumulate in the lower parts of the body due to gravity, especially the feet and ankles. Also notice something else. If you wake up in the morning with puffiness or swelling under your eyes, this can also be a sign of kidney stress. Test 2. The foam test. Observe your urine carefully. Does your urine produce thick, white foam that looks like soap bubbles, and does the foam stay even after flushing? This condition is called proteinuria. A healthy kidney works like a fine filter. It removes waste from the blood but keeps important proteins inside the body. However, when the filtering membrane of the kidney gets damaged, tiny holes become larger and protein starts leaking into the urine, which causes foamy urine. Test 3. Night urination test. Ask yourself this question. Do you wake up 2 or more times during the night to urinate? Note that we are not talking about drinking a large amount of water right before bedtime. If your sleep is regularly interrupted by frequent urination, it may indicate a problem. Normally, at night the kidneys concentrate urine so that we can sleep peacefully. But when kidney function is impaired, the kidneys lose the ability to concentrate urine, forcing the body to eliminate water more frequently during the night. Test 4. Color and fatigue test. Stand in front of a mirror and pull down your lower eyelid. Is the inner part pale or yellowish instead of deep pink? Also check your tongue and the palms of your hands. Do they look unusually pale? And do you often feel constant fatigue even without doing much physical work? Your kidneys produce a hormone called erythropoietin. This hormone signals the bone marrow to produce red blood cells. When the kidneys are damaged, erythropoietin production decreases, which can lead to anemia, known as renal anemia. Test 5. Breath odor test. Pay attention to your breath. If your breath smells like ammonia or urine, or if your mouth constantly has a metallic or bitter taste, it could be a warning sign. When urea levels increase in the blood, bacteria in the saliva convert it into ammonia, causing a distinct unpleasant smell in the breath. This condition can also reduce your appetite, making food taste unpleasant. Test 6. Nail examination. Look closely at your fingernails. If the lower half of the nail appears white, while the upper half looks pink or brown, this pattern is called Lindsay's nails. This can be a clinical indicator of chronic kidney disease, CKD, and is sometimes seen in patients with long-term kidney problems. Now comes the most important part. If you failed one or more of these 6 tests, it does not mean that your kidneys will fail tomorrow. What it means is that your kidneys may be sending you an SOS signal. This is not the time to panic. This is the time to take scientific action. Here is your 3-step recovery plan. Step 1. Clinical confirmation. Home tests are only early indicators. The final confirmation must come from medical tests. Visit a good laboratory and get these tests done. 1. eGFR, estimated glomerular filtration rate. This is the most important test. It tells you how efficiently your kidneys are filtering blood. Above 90, normal. Below 60, possible kidney disease. Below 15, kidney failure. 2. UACR, urine albumin to creatinine ratio. This test is the advanced version of the foam test. It can detect very small amounts of protein in urine that a normal urine test may miss. 3. KFT, kidney function test. This includes serum creatinine and blood urea nitrogen levels. Remember, creatinine usually rises only after about 50% kidney damage has already occurred, so it should not be the only marker you rely on. Always check eGFR. 4. Ultrasound KUB. This scan helps determine whether the kidneys have shrunk in size, or if there are stones or cysts present. Step 2. Stop the kidney killers. Even before seeing a doctor, these 3 lifestyle changes can help protect your kidneys. 1. Avoid unnecessary painkillers. If you frequently take painkillers for headaches or body aches without medical advice, stop this habit. These medicines can directly damage kidney nephrons. Always take them only under a doctor's guidance. 2. Control salt intake. One of the kidney's main jobs is to remove excess sodium from the body. To reduce the burden on your kidneys, avoid adding extra salt to your food and limit processed foods like chips, pickles, and packaged snacks. 3. Manage blood pressure and blood sugar. Globally, about 70% of kidney failure cases are caused by diabetes and high blood pressure. If your blood pressure is above 130/80, your kidneys may be under constant stress. Step 3. Improve your diet with medical guidance. Consult a nephrologist for proper diet planning. Balanced protein intake. If protein is leaking in your urine, a very high protein diet can increase kidney workload. Hydration control. If your body has swelling or fluid retention, drinking excessive water can also be harmful. Ask your doctor about your ideal daily fluid intake. A very important question. Can damaged kidneys recover? If kidney damage is acute, meaning sudden, it can sometimes recover completely with proper treatment. But if the damage is chronic and long-term, full reversal may not be possible. However, the good news is that if detected early, we can protect the remaining kidney function for the rest of your life and potentially avoid dialysis or transplantation. So don't wait for tomorrow. Start listening to the signals your body is giving you today. Your kidneys are your silent heroes. Take care of them.